you for holding this really important hearing, because I think it is hard, I think, for many colleagues to understand that we are talking about drug dealers here. They may have suits, they may be white, and they may have money, but they're still drug dealers. And that's exactly what they did. They're using our system right now to get away from thousands and thousands of families within all of our districts that were impacted by their drug pushing. And so I want to talk about that because I think that is really important. It's not immigrants or China that are drug dealing here. It is these kinds of families that are profiting off of that. And how come we're not equally maybe committed to addressing that? I think is really problematic here. That's the focus of this committee hearing. And I think it's really important because you're just allowing more opportunities for the folks that you're supposedly trying to protect to get harmed by these folks. You know, the members of the Purdue's board of directors, their own board of directors, the Sackler family approved the company's marketing campaigns, right? And I remember David Sackler actually came before our committee and I asked him about one high value prescriber that was contacted by sales representatives at least 290 times between 2010 and 2018. That's more than 3 times a month for 8 years, right? And so Purdue's sales executives referred to this prescriber, you know, okay, doctor, whatever, Candyman, y'all. That was the name of the prescriber. They were by no means the only one. He may have the nickname Candyman, but that's who the Sackler family was, you know, pushing the drugs through. And as part of the one campaign, the campaign that they were pushing for, I think they called it, and just as this is important for my colleagues to understand this, they called it the turbocharge sales. You hear that? It's called turbocharge sales. They can call it whatever they want, but they literally used it to push out the drugs into our neighborhoods and through pharmacies. And then at one point, the representatives were required by Purdue sales, representatives were required to target what they call high value prescribers like Candyman, at least 24 times a year to get them to, quote, commit to writing more OxyContin prescriptions. So, you know, Attorney General Healy, I can sense your frustration. You know, I'm an attorney myself, and I'm someone that I really want to put the bad guys and whoever it is behind. You know, you have to focus on those that really profit off of the pain to really get to the chronic, I think, targeting of communities like mine. And that's exactly, you know, they targeted communities that were vulnerable, that were already struggling with maybe poverty and some other issues, as you probably know. And it's so unbelievable to me that they continue to be able to walk away with no harms, no sense of accountability. And so I want to hear from you. I mean, when you look at these kinds of cases and you see the drug pushing happening, I mean, what are things that we can be doing right now to push up against that? Because again, it is our residents that are directly impacted by it.
Well, I thank you for your comment. And I'll just note that opioid overdoses and deaths are up nationally and up among communities of color. In Massachusetts, where I am, there was a 69% increase in opioid deaths among Black men last year alone. It is heartbreaking, and it's just yet another effect, you know, of this crisis. I also want to be really clear. There's been a lot of discussion about China. There's been a lot of discussion about Mexico. There's been a lot of discussion about synthetics being made elsewhere, brought here. Where did they learn that from? They learned that from the Sackler family.
Exactly. And Ms. Healy,
it's manufactured in the lab. So what I think is important here in terms of what we need to do going forward, we need treatment big time. We need way more services for substance use disorder and behavioral health. We need it to be culturally competent. We need to meet people where they are. We need to do the work that we're doing around education and prevention. I strongly believe in that, while we continue to hold those accountable who need to be held accountable. I've gone after doctors, pharmacists, pharmacy change, and manufacturers and distributors, right? You gotta sort of cover it all. But I think we need to recognize the humanity in this and be—
Well, Ms. Healy, we have to recognize there's two, it seems like everybody's for justice and accountability, unless it's somebody that looks like the Sackler family. I want to be honest here. I'm really frustrated from hearing colleagues it's not immigrants or China we're talking about here. We're talking about people right here in the United States using our own systems and court systems to get away with hurting and killing our neighbors. And we're doing nothing about it. We're literally turning our heads and pretending like these private citizens, poor babies, they didn't do it. They had a sales campaign targeting. They might not have been on the street corner, y'all, but they definitely had easier access into our pharmacies, into our homes. And we're turning our back and saying it's okay. They're private citizens and they're going to go through the court process. Well, guess what? It is set up in a different way to treat somebody like the Sackler family versus some of my residents that unjustly get targeted. And so you can hear my pain, but it was a long hearing of hearing people defending a family that hurt our neighbors, our residents. And this is generational trauma that they'll continue. And, Chairman, I will yield, but it is so important to understand families will be impacted for generations to come. Generations, because we looked away.
Thank you.
And so with that, I yield.